Good morning, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. Today is Thursday, December 23, 2021. Thanks so much for joining. This is, as always, your opportunity to get your COVID questions answered. So pleased today to be joined by Alderwoman Pat Dowell. You are the alderman or the alderwoman from the 3rd Ward.
3rd Ward, yes.
And let folks know, where that ward is. I think you've been in there since 2007, right?
Right. I was elected in 2007, and my ward is basically the South Loop, Bronzeville, Washington Park, Fuller Park.
All right, and Alderman Dowell is also the chair of the budget committee. Let me get the exact title here. The
Budget and Government Operations.
There you go, Budget and Government Operations. We've got to get it correct. And so, a lot of the work that was done, really figuring out how are we spending the big federal funds that are coming with the ARP, a lot of the big new investments, working on, with the whole of City Council to get decisions made. You really headed that off. So
right. It's been a pleasure working with you.
Yeah.
I mean, you have a lot on your plate.
Well,
and a lot of the resources are directed to your department.
Yeah, I know, exactly. It's been a year. So thank you, for all the partnership and conversation on that. So as always, this will be your opportunity to direct questions really to either of us. We're going to keep the focus primarily on COVID, but we'll talk a little more with Alderman Dowell in just a moment. And as always, we will start with the dashboard. Reminder, you can put questions directly into the box below. You can also use the hashtag AskDrArwady on either Facebook or Twitter. So let's pull up the dashboard. And those of you who have been following this closely, there's been a lot going on this dashboard. So you can see right now in Chicago, look at this. We are averaging 2,345 cases a day. And if we zoom in on this a little bit, reminder, you can click there and see, we've had a couple of days here that are over 3,000. We have broken the case record for the year 2021 since vaccines were available, and I expect in the next day or two, unfortunately, we will break an all-time record for COVID cases. I want to talk a little bit about what that means, of course, and some of what we're watching, but a lot of what we're looking at is hospitalizations here. Now, we got some questions in already about sort of this hospitalization number, that hospitalization number, what do we mean? And so here, this is telling us how many Chicago residents on average are being hospitalized newly each day with COVID. And we're seeing somewhere in the 64 to 65 new Chicagoans hospitalized each day. But in addition to that, even in the last couple of days, we've been over 100 for that. And our Chicago hospitals often keep people, of course, more than 1 day or 2 days or 3 days, especially if they're sick enough with COVID to be admitted. They also are referral sources. So if there are hospitals that are getting more full downstate, they move it in. And so I wanted to just show you here, up at the top where there's latest data, this is where people were asking, where can I find out more about breakthroughs and variants and wastewater surveillance? It's all here. And the hospital capacity chart is where every single day we update, the hospitals report into us what is happening this day in terms of COVID beds, non-COVID beds, what is capacity. So you can see, as of December 22nd, across all Chicago hospitals, there were 835 non-ICU beds, meaning regular hospital beds with COVID-19 patients in them. And we've got 16% of our hospital non-ICU beds available across the system. You can see this too really going up. And in the same way, that big spike sort of since yesterday, hospitalization is also the highest that it's been this calendar year. But whereas earlier, when we were seeing these huge surges in cases, they were very quickly turning into hospitalizations. The good news is that where people are vaccinated, especially and boosted, they're much less likely to be admitted to the hospital. So that is the best news anywhere. But you can look and see ICU numbers. You can see we have about 14% ICU bed capacity across the city right now, and another 208 folks in the ICU. You can look at ventilators. So if you want to follow a little more closely what's happening with hospital capacity, that's where you can do that. But coming back to the dashboard here, we're seeing about 9 Chicagoans a day right now dying with COVID. Again, you see that increase. We're doing the most testing we've ever done, 33,000 tests a day, lots of days over 40,000. That's partly because of the surge, partly in advance of holidays. We'll talk about that if you have questions. But even with testing going up, look at that positivity, 8.6%. 1 week ago, it was 4.4%. So the fact that we've seen cases more than double in a week, we've seen positivity more than double in a week, even with testing going up, this is the Omicron surge, and that's what we're going to talk about. Vaccinations, I do not like that that number is down, because when cases are going up, when this is red, when positivity is red, I would hope that we would be seeing vaccinations really shooting up. And this little dip here was Thanksgiving, and we were not really seeing them going up like we need them to. And so that was some of the decision for the announcement that we made earlier this week with the mayor to require proof of vaccination for some of our highest risk indoor settings while we get through the Omicron surge. So let me just show you a few more things here on my slides, and then we'll turn to your questions, I mean. Okay, so first of all, what did change in the last week or so? One word, Omicron. We were already, as you know, in a Delta surge here in Chicago, here in the Midwest, and that was as cold weather was coming in. But if you look at this, this is from Region 5, meaning this is the Midwest, and each of these vertical lines here are the weeks going back to September. Orange here means Delta. Purple means Omicron, and black means other. And so you can see almost everything, more than 99% for months and months here, has been Delta. And as recently as the week ending December 4th, we were just starting to see a tiny, tiny bit of Omicron. See that purple down at the bottom there? I can tell you, I had the team go back and take a look. And right here in Chicago, where the Chicago Department of Public Health is collecting samples, we work with Rush University to do that genetic testing. The week December 4 through 6, we only had 2 Omicron cases out of about 300 that were done, and the rest were all Delta. But just like we saw happen in South Africa, literally in the matter of 2 weeks, we went from almost none to the majority of cases now being Omicron. And the thing with Omicron is it is much more infectious, probably in the range of 3 times as infectious, so you don't need to be exposed to as much. And we are seeing more infections. We are seeing people who have already been vaccinated getting more breakthrough infections, although they're not likely to get seriously ill. We are seeing more cases. We are seeing a lot of unvaccinated people get COVID. And again, most of our hospitalizations and deaths are in folks who are unvaccinated. If we put those numbers into our community transmission and risk matrix, you see the cases per day are in that very high transmission. When we're averaging more than 800 a day, and we're 3 times that right now, we're in very high transmission risk in terms of cases, and our positivity here is also high, and that moved from low to high just over a matter of days. But you see here that our hospital capacity, certainly we're concerned about it. It's in the substantial transmission, the substantial risk range, but in previous waves, when cases here were up to very high and positivity was up to high or very high, we also saw these numbers already up in the very high range for hospitals or ICUs. So if there is any good news here, it is that Omicron is already here. This is not a Delta surge with Omicron still to come on top of it, and that vaccines continue to protect well against hospitalization and death. I wanted to just show you nationally that we are very much at the epicenter right now. If you don't know this map, darker means a higher number of cases per population. And for months and months, probably just about the whole year here, Illinois and Chicago well below the national average. But with this Omicron, you can see on average, we're at about 43 cases per 100,000, which is, by the way, high risk across the whole country. But Illinois is about twice that, and we're right up there with them. So that's why there's been a lot of focus right now. Hospitalizations, on the other hand, though, you can see we're still sort of okay at the moment, but obviously concerned, especially where people who have not yet had a vaccine do get COVID, that they are more likely to end up in the hospital. So that's what we're watching. Here is what our hospital census is looking like, sort of per 100,000, and it's been ticking up really since November. This again is similar to what we looked at on the dashboard. I do think we'll see probably a little bit of a drop over Christmas just because testing patterns change, and then I think it'll be right back up again. This is just, again, some of the non-ICU and ICU beds. A reminder, right now there's a lot of attention. Those of you who watch this regularly know we talk about this a lot. This is like Epidemiology 101. The way a disease shows up in a population is partly about the pathogen. The pathogen in this case is the virus, and there can be changes in the pathogen. So this Omicron is a change in the pathogen, but it's not all about the pathogen. It's also about the host. The host is us. And hosts change in terms of, have they previously had COVID and have some level of protection? Have they been vaccinated? Have they been boosted? Do they have underlying conditions? Do they have immune compromise? And then the environment, things like how much are people masking? Is it winter? Is it, things like this? All of this comes together when we're thinking about it. I'll just finish off by comparing. This is Chicago data only, where red are our number of cases in people who are unvaccinated, and blue in people who are fully vaccinated. And you're seeing, even just since Thanksgiving, infections alone, not serious, just infections, 3 times as likely in unvaccinated Chicagoans, even though more Chicagoans are fully vaccinated. If we look at cases, this is 5 to 11-year-olds. On the left here, we're seeing, where are we seeing a lot of 5 to 11-year-olds being infected? Red is the highest number of 5 to 11-year-olds. The darker blue would be next. You can see, in South Loop here, there's quite good, Alderman Dowell, in terms of COVID cases. And then in comparison, here's the vaccine coverage. So red here means low vaccine coverage, less than 18% of 5 to 11-year-olds have had that first dose, and it is in the same parts of the city where we see low COVID vaccine rates in the kids is where we're seeing high COVID rates in the kids. So it's working in kids just like we see it in adults. If we look at hospitalizations, this is really the thing. Boy, see that red line? Those are our unvaccinated Chicagoans. Just since Thanksgiving, 5 times as likely to be hospitalized, and my biggest concern is there. Here's what recent COVID hospitalizations look like by Chicago zip code, again, just since late November through December. And this really is overlap with where we see lower vaccination rates. This is the graph we showed at the press conference, but I wanted to highlight every blue bar here, all of the blue, are unvaccinated Chicagoans who have been hospitalized with COVID, so seriously ill, going all the way back to the beginning of the year. So obviously, early on in January, most people had not yet had the opportunity to be vaccinated. As we move ahead, red are hospitalizations in vaccinated Chicagoans, so quote unquote breakthrough hospitalizations. We have seen some more of those as we move down. We've gotten more than 6 months from original vaccination. We've seen the variants emerge to be more infectious, but nevertheless, even right now, see how all of that is blue? Just about all of that blue is preventable if people are vaccinated. And now is the time, if you haven't had a chance to do it. Booster is also important. And then similar, here's the death rates for Chicagoans right now, fully vaccinated versus unvaccinated. And most of this increase is being driven by folks who are unvaccinated. If we look at the pattern for recent COVID deaths, and this is recent just over the last 6 months, but highlighting, again, this is a direct match for where our vaccination rates are lower. We have had more than 3/4 of eligible Chicagoans, 5 and older, get a first dose of vaccine, 68% fully vaccinated, 79% of those over 12 get a vaccine. But I am very worried about the hundreds of thousands of Chicagoans who have not done that yet. And if we look by age, you can see we're almost to 1/3 of the 5 to 11-year-olds have had a first dose, and over 70% for the other age groups. But we are definitely seeing a lot. And so, as always, you need a vaccine, you need a booster, you have a question. 7 days a week, we continue to take your calls, 312-746-4835. You can go to chi.gov/COVIDvax for more information. So let's end the slideshow and kind of get into some questions. So let's kind of start a little bit with you. So talk to me a little bit about what you're hearing from constituents right now. What are they worried about?
You know, Dr. Arwady, as I've looked at your dashboard and the numbers, I can definitely see the differences in my community.
Yes.
In terms of the South Loop community, they're vaccinated at above 90%
Yep.
or at 90%.
Yep.
In Bronzeville, for example, it's below the 77%, I think, that
Right.
you guys want. We're at like 67%.
Yep.
So I get a lot of questions from my constituents about where they can go to get vaccinated.
Yep.
I think people are not aware of an easy way to
Yep.
get that information
Yep.
like that.
Yep.
And they depend on the alderman's office
Yep.
to get that information out. So I think the website for us is very effective. In the main, most of the questions that I receive relate to things that are non-pandemic related.
Yeah.
They're related to concerns about where to get food,
Right.
how to get Christmas toys because
Right.
a family is challenged economically, how to get a donation of a coat, a
Yep.
warm coat for the
Yep.
winter. So those are the kinds of questions that I get.
Yeah, and I think, a couple things on that. So first of all, right, chi.gov/COVIDvax, that's your stop for finding a vaccine. Vaccines.gov is also just increasingly strong. That is the federal work to pull together all of the vaccines options. So if you're watching us outside Chicago, for example, you can also go to vaccines.gov, put in your zip code. It will show you where is there vaccine available around you, and you're able to click and make appointments right on there. But I want to be clear, we have vaccine. There is plenty of vaccine. There are plenty of boosters. You might not be able to get an appointment for today, especially with the holidays, but you can make an appointment in the next few days, and there is vaccine accessibility, and we want to help get that sorted.
The other thing I've noticed too, we have a couple of testing sites in my community, and I've seen the long lines.
They're busy, yeah, no, and we've seen that too. So, and yeah, thanks for raising that. So even on the way over, there's a big downtown testing site here, and it's the whole pandemic since they've been open, it's my daily sort of like, how are they doing? And there is a bit of a line out there. It's not as long as what I've seen in some other places, but expect that you may have to wait to get tests. Maybe let's talk a little bit about testing access for a second. So first of all, chi.gov, just like chi.gov/COVIDvax is your vaccination information, chi.gov/COVIDtest is your testing information. We, meaning CDPH, has worked, just so you know, behind the scenes to make sure that we are adding testing capability, especially in parts of the city where there's not as much healthcare access. We've worked to distribute some of the at-home tests, which we are expecting there to be even more of these available with the federal announcement earlier in the week. We have continued to sort of put testing and have free neighborhood testing available. There are also more than 50 pharmacies concentrated in the areas where there are not as many pharmacies available or not as much healthcare that have entirely free testing available. But I would encourage you, if you haven't already done this, if you do have the means, I would order right now some of those at-home vaccine swabs.
And we want to thank you in CDPH for providing the alderman's offices with supply.
Yeah.
That's been very helpul. We have had people come through to request a box for testing.
Yeah, and we offered to all the aldermen, ahead of Thanksgiving and just surges. We've done that with community organizations and partners, our own sort of door-to-door, and where we're doing case investigation, really working to make sure those are getting where they're needed. But I really like these at-home tests because you can get a result right away, right? And so the ability to add those on to make holiday gatherings even safer, for example, I think is really a good move. So if you have the means, I keep some just at my house that I ordered online, and I would do that. Also, there is federal testing availability. Biden announced that, earlier this week they're going to increase another 500 million of those at-home tests, including a way for people to be able to order them directly.
I think that's excellent.
I do too.
Having that access and the ability to do that in your own home, quickly, is a good thing.
Absolutely. And maybe, just to the point of sort of food and coats and toys, people might not know that, the number one call that we get for our, we have a whole team that also supports people who have COVID and have needs, have to get hooked up to a provider, have issues with needing things for work, whatever it might be. And the number one ask there too is food insecurity.
Yeah, during the pandemic, our office has given away food boxes almost every Wednesday. We have ceased doing that now because of the winter, but very much needed. Lots of people come through wanting that, and now we're facing questions about toys and clothing.
And so I think, you know, again, a lot of attention on COVID right now. You're probably worried about it. If you do have the means to be, you know, contributing to one of the food support organizations in town, or taking a little bit of time for some of those families, because stretched families all the time are even more stretched during COVID, is what we've seen, you know, over and over again. So good reminder there. Okay, let's maybe take a few questions here, and then we'll chime in. So, right off the top, Maria on Facebook. Dr. Arwady, should I host my Christmas dinner? Do you want to talk a little bit about what you're thinking about, and I'll talk about it, because these are individual decisions, and I want to. Certainly, I will talk you through my thinking on this, but I know, you know, as someone who I'm sure has conversations and is thinking about risk, anything you want to say about, you know, either yours or your constituents, or kind of how you're navigating this?
Well, you know, the way I personally am navigating it is I'm not going anywhere, and I don't have very many people over to my house. I'm an only child, and I prefer it. You know, but what I tell my constituents is that, you know, if you're fully vaccinated, you have your booster, maybe you've put in a testing protocol for the event, that you should do that, and keep your mask on. No matter where you are, keep your mask on. That's a very hard thing to do around friends and family, but it's necessary.
No, and I absolutely agree with that. You know, I'm getting every version of this question you can imagine right now, and people are asking very specific questions, like, here's all the status of everybody, and, you know, this is my exact tradition that I care about. And, you know, I cannot make a decision for you in terms of sort of what are your individual risks, what is the situation. But very top line, what I say, and maybe I'll just talk about my sort of personal decision making too, is that vaccinated and boosted is the top thing for me. So I am getting together sort of with my sort of smaller immediate family. Everybody's vaccinated, everybody's boosted, and there is the ability to do some testing on top of that, just to make sure in case anybody has a breakthrough. And especially this time of year where there are traditions that some people really care about. I can tell you, for example, my brother was here with my 6 and 10-year-old niece and nephew, and traditionally they would maybe come in for a long weekend, you know, during the holiday season, and maybe we would go to some of the large kid indoor events, etc. They are both fully vaccinated, but we made a decision, which traditions do we care about the most? And I went to the Nutcracker with my niece. We both showed our vaccination cards. Everybody was masked. We did not take off our masks to sort of get a drink at intermission. You know, we thought about spacing, but that was something where we're fully vaccinated and boosted and cared about, that I felt, you know, was important to do. Things like the zoo lights has been good. It's out of doors. Things where you can just think about limiting risk. So
I've had a good friend of mine who has an annual New Year's Eve party. Actually canceled this year because of the new variant. And you know, I think that was a wise decision. And I think, and again, it just depends a little bit on sort of who's coming, what the issues are. But if you've got folks who aren't vaccinated, especially, or you don't know, I'm not real comfortable at all. I'm doing everything I can to sort of limit exposure right now to anybody I know that's not vaccinated and boosted, being very careful with masks. I live alone as well, actually, and I can tell you this last weekend, which normally would have been a weekend I probably would have been out and about, I was home the whole weekend. One person was over for a relatively short time for something that needed to be done. We were masked that whole time, and you know what? That person ended up testing positive for COVID. Oh, no.
But I'm not too worried because we were both vaccinated, asymptomatic, masks, right? But that's just even where we're limiting it. Just everybody has COVID right now. You know, I've tested, I'm fine, but it is sort of a little bit of a risk conversation. So I think hosting the Christmas dinner, if you're able to do that in as safe a way as possible, and that's a really important tradition for you, is good, but it is probably not the year to be doing as much of the sort of large, less controlled settings. That's my personal feeling. And somebody asked me like this morning, you know, should I go to a funeral? Like, again, if the funeral...
Now, that's a good one.
Yeah.
I mean, what's your thinking on
Yeah,
that?
so my thinking on that really comes down to, you know, funerals are an example of something that you can't, in most cases, postpone, assuming you're not deciding it. And if this is someone who you were very close to or you're close to, you know, it can be a really important commemorative event. I personally would not go to a funeral right now if I were not fully vaxxed and boosted. I also would not go if I wasn't confident that everybody was going to wear a mask, and I wouldn't be taking my mask off in that setting. So often where there's a funeral, you know, typically there's lunch, et cetera, I wouldn't do that right now. That's just me. But the risks are high, but again, it's sort of balancing some of these risks.
I think the decision I've made for myself is to acknowledge the family by attending the wake. And giving my condolences, but not to stay and linger. So
yeah, I think that's smart.
It's unfortunate that you have to change your behavior, modify your behavior because of this pandemic, but it is necessary.
It is, yeah. And I think, you know, you're getting a sense here, like, everybody is going to have slightly different levels of that risk tolerance. And for my mom, who is older, has underlying conditions, et cetera, I would have unless it was somebody she was very, very close to, I would not probably be, you know what I mean? And so, but yes, thinking about how to limit that risk. Go to the wake for a short period of time. Think about a way to, you know, show that respect, but not potentially be in contact with a lot. That's exactly the kind of thing. If you are having people, you know, over during the holidays, can you at least, you know, open the windows? Can you, you know, each of these things adds to protection. And at some level, a lot of you write in all the time, we have to just live with COVID. I do agree with that to an extent. We're not going to eradicate it, but when we are in a big surge like that, living with COVID does mean not overwhelming our health system, not having sort of a lot of unnecessary hospitalizations and deaths, and that's been some of the decision. But yes, I do think time with grandparents, time with tradition, I think that is also important, but thinking about which of those pieces are the most important, and maybe you don't do the 15 things you might have done, you choose one or two and have them be a little smaller. So yeah, and all of you, we're getting so many holiday guidance questions, so I hope, you know, I'm trying to just like hit on a bunch of these sort of all together a little bit. Diane Ponder on Facebook says, if I have a booster, should I fly or take the train? Should I stay home on New Year's Eve? So I know a lot of you are traveling. As a reminder, anybody who is unvaccinated at this point, virtually the entire country is under the City of Chicago travel advisory, so we would be advising against travel for anybody who's unvaccinated. And when you return to Chicago, you need to quarantine, test, like don't travel if you're not vaccinated. However, Diane here, it sounds like she's vaccinated and boosted. If you're asking, should I fly or take the train, I would say in both of those cases, it's mostly about the length of the trip, as well as how much you might be able to continue to keep the distance. The air handling in airplanes is actually quite good. It's not the airplane itself that we worry about as much as just the crush at the airports, the potential crush at the train station, et cetera. If you are vaccinated and boosted and you're wearing a good mask, I think you could fly. I do. If you have a big underlying condition you're worried about, you may want to limit that. But I don't think it's inappropriate. Again, everybody's doing their own risk balance.
Does the website have information on what makes a good mask?
Yes, we do have some, but let's talk about that a little bit. Yeah, so the most important thing in terms of masking is that everybody has one on, because the number one thing that a mask is doing is what we call source control. It's keeping my germs to myself. And so I care the most, and that's part of why in this surge we continue to have the indoor mask requirement in public spaces, right? So my biggest thing is everybody having some kind of a mask. We do see more personal protection with some of these higher quality masks. So what does that mean? So for example, again, my main thing is, do you have a mask on at all? Second, you want this mask to fit well. So I don't love it when I see people wearing masks that are falling off their nose and under here. You know, that's not really doing a lot to keep your germs to yourself, and it's doing even less in terms of potentially protecting you. In terms of protecting you, I will sometimes, I like the surgical masks. Those are those paper, those blue ones.
Yes.
Yep, you can get a box of those for about $8 at this point, of like 100 of them. Those are nice because you can tie little knots in the, you can really get a nice tight fit. They have the wire, you can have it, so I like those. And then if you want to take it one step further, there are what are called KN95s. You might have heard of this. Those are an even tighter seal to your face. And so they do an even better job in terms of keeping germs out from you. So I have some of the KN95s, and if I were going to go on a flight, for example, maybe right now, I would probably put a KN95 on. Those are also widely available, and we're actually looking into getting some more to be able to distribute in community settings. Yeah, I think that's a good, very practical question. But the main thing is everybody with them, and then right now with the surge, having some more. And to the question of staying home New Year's Eve, I think it depends what your plans are. But trying to keep it a quieter New Year's Eve, I certainly would recommend a quieter New Year's Eve than I would have even a month ago with where we are right now. Okay. We're just going to stay on this topic for a second, I think, because this is what everybody's wanting to know. Patty Graff on Facebook says, I'm desperately trying to make a decision. I have newly vaccinated but not boosted 2 grandkids, and boosted parents stay overnight during the holidays. I'm 70, I have typical medical issues. I'm at higher risk even though I'm boosted. My brain says it's not worth the risk. My heart says it is. What does your experience say is the prudent thing to do? Okay, so a couple things in this. Your grandchildren, I presume they're young enough that they're under 16 and haven't had the opportunity to be boosted. But regardless, if they have just been vaccinated, they don't need a booster yet. They would be considered fully vaccinated. So that's part of the reason I took this question, because it highlights this. Remember the recommendation for a booster. 6 months after completing Pfizer or Moderna series, you should get a booster. And I would recommend sticking with the same one you got, Pfizer or Moderna. 2 months after getting Johnson & Johnson, you should get a booster. And I would recommend for that booster getting either Pfizer or Moderna. J&J in particular, we see have less protection against Omicron. And so I especially, if people are depending on sort of the older, kind of a longer ago J&J vaccination or an older infection, now is the time to sort of be getting that booster, getting vaccinated. So I am not too worried about newly vaccinated but not boosted grandchildren, because they are fine right now. They're as vaccinated as they should be. And if the parents are boosted, that also suggests to me there's been, relatively low risk, and you are boosted. And so this sort of brain heart is exactly what people are thinking about. And I think I would recommend in this setting, given I can tell everybody's worried, I would have everybody take a test, like right before if you're able to. If you can't get some of the at-home tests, you might have to get the one that you have to wait a day or two for. Have folks do that. And in a setting where everybody's as vaccinated and boosted for age, if folks can get a test and feel confident, I don't know, your heart is telling you it is, so I can't make that decision for you. But I think it is probably all right, recognizing that you do not eliminate the risk of COVID infection, but in a fully vaccinated and boosted for age group. And testing. But you're right, well, and testing helps, but the fully vaccinated and boosted for age means even if COVID were in there, the chances of anybody getting seriously ill are low, even for somebody who, is older with an underlying condition. And then testing on top of it helps limit, that risk for COVID. So I hope that helps. And I know a lot of you are wrestling exactly with this. And maybe just, Velma V on Facebook. What if I'm vaccinated but family members are not? What should I do? I would not be gathering right now if this is a Chicago-based or even Illinois-based or even Midwest-based gathering with people who are not unvaccinated. I know that's hard, but it's just, I would not recommend it. Okay. So
I have a question,
please
Dr.
do.
Ardi,
Yes.
Dr. Arwadi. If you were vaccinated with Pfizer,
Yes.
and maybe it's time for a booster,
Yes.
but you just said that Pfizer does not look like it's.
J&J does not look like.
I mean J&J,
Yes.
right? So you would recommend that that person who had J&J now get a Pfizer or
a Moderna booster. Yes,
Okay,
exactly.
that's clear.
So yes, exactly. If you had J&J, and this actually is not, the CDC is now recommending Pfizer or Moderna over J&J formally, partly because J&J, when they tested it, we saw a drop in protection for all the vaccines, but a big drop for J&J, and then for AstraZeneca, which we don't really have here, but they work similarly. It's not working well against Omicron. And then also there is, very rare, but there is this blood clot, potential that got a lot of attention months ago. And so they are formally recommending, J&J is still on the market. We have it available. There are some people who, for whatever reason, J&J is the one they got. That's fine. You can get the J&J booster, but my recommendation would be, whether you're getting a first, a second, or a booster vaccine, I would get either Pfizer or Moderna, and there's not a big difference at all between those.
Okay.
Yeah. And Megan, in follow-up here, actually says, if I got J&J, am I no longer considered fully vaccinated? Do I need to redo my entire vaccine series? Yeah, good question. You are considered fully vaccinated in terms of public health requirements. So there has not been a change in that at this point. So if you're asking, are you considered fully vaccinated in terms of, will your card, get you into a music venue? Will your employer accept it? Is it, can you use it for travel? Yes, you are considered fully vaccinated. However, from a public health protection standpoint, you don't have a lot of protection right now. You do have some, certainly, against severe illness, but I would encourage you to get a booster. You don't need to redo your whole vaccine series. If you had J&J, you can get one shot of either Moderna or Pfizer. You're totally caught up again. Okay, so we've got a number of questions on this vaccine requirement part. So, all right, Mary Jo asks, if the definition of fully vaccinated is changed to include the booster, would that mean people with recent vaccines would not be able to go to restaurants, et cetera, for 6 months until they get the booster? No, that's a good question. The new requirement, maybe just to review that quickly, is that as of January 3rd, in the city of Chicago, someone else has a question, is just the city, is this the state? It's not statewide, but it is in Chicago. We may see Suburban Cook make some decisions there, but it is for the city of Chicago. As of January 3rd, you will need to be fully vaccinated, meaning, as it is defined right now by the CDC and everybody else, 2 weeks after a second dose of Moderna or Pfizer, or 2 weeks post a single dose of J&J. I really, really, really want to see boosters on there, but it's not required. You would need to show that proof to get into higher risk settings in Chicago. This is similar to what others have done. So if you want to sit down and eat a meal in a restaurant, you want to go into a bar and be able to take your mask off and drink and enjoy that. You're wanting to exercise at a gym, you're going to a larger entertainment venue, food and drink are being served, you have to show proof of vaccination as of January 3rd. And so, and that is for ages 5 and up. So that is just to try to do everything we can to keep those higher risk settings open and as safe as they can be to help protect the employees in that setting. There's lots of details if you go to chicago.gov/COVID if this is news to you. So Mary Jo here is saying if the definition changed, if it gets changed by the CDC, for example, to include the booster, would I have to wait 6 months? No. So fully vaccinated, if you are up to date basically with your vaccines, you'll be considered fully vaccinated. Gina on Twitter is saying, if the case numbers drop dramatically, will these mitigation measures be revoked? Yes. So I want to be really clear. Things like our mask requirement, things like this new vaccination requirement are in place because we are at this high risk state. And the CDC defines 4 levels of risk, sort of low, medium, high, very high. And while we are in one of those top 2 levels, that's where the CDC says everybody should have masks on inside. and everybody should be vaccinated. As soon as we drop down below those levels, and that's part of why we track these levels and I show them to you all the time, that's the setting where we don't need to wear masks indoors, where we can drop this vaccine requirement. So yes, as we see these numbers come down, of course.
I have another question,
Please.
Doctor. The vaccine requirement, do I have to have the hard card, or can I have a picture of it in my smartphone?
Yeah, great question. You can have a picture in your smart code. You can have, and there's some details on that website if you want to see. You can bring in your card. You can bring a picture of your card. You can bring one of the apps that people use to sort of put the card in. If you've lost your card, you can bring a printout from your medical provider, from the place that you got the vaccine. You can use the state's Vax Verify and download it. We've detailed pretty specifically what you would need, but you will need to show proof of vaccination. It's got to have the date on it, your name, et cetera. And then for those over 16, you actually have to show identification as well to make sure that that vaccine record does match you. So Karen Ho on Facebook is asking, restaurants, gyms, and other public spaces will be requiring proof of vaccination. Why not schools? So we thought a lot about what is essential versus what is more optional right now in terms of this requirement. School, I would argue, is essential. Even work is relatively essential. And where we were working with the industry here, we did carve out for employees. If they are not fully vaccinated in these settings, they have to do regular testing and they have to wear a mask at all times, but we did carve them out. But for things like being able to go out and eat in a restaurant, going to some of these entertainment venues, those are more optional, and those are the settings where it will be required. You can still go to the grocery store, for example, without having to show proof of vaccination, but even within the grocery store, if there's one of those little cafes that you want to sit and eat, you would have to have proof of vaccination if you've got to take off your mask to do that. Schools, that's another entire conversation, but we consider schooling essential. And while we continue to work on getting kids vaccinated, I hope that there are parents and guardians who want to be able to take their children to do some of these fun things and may make the decision. But we are not anticipating a school requirement right away at this time. Okay. Oh, here's a good question. Simone Downs on Facebook says, my sister tested positive last week. Do we know what variant of COVID she would have? Is that noted in the rapid or PCR test? That's a really good question. No. So when you get a COVID test result, you just know positive or negative. This work of testing samples from across the city, across the country, the work of getting the genetic fingerprint of a virus is a very specialized kind of test, and it actually takes quite a lot of time, more than a week to be able to do that kind of testing. And it doesn't have any impact on how you would be treated. It doesn't have any impact in terms of our guidance to you, in terms of what you have to do. So if she tested positive last week, that graph that I showed you right at the beginning, it's probably a 3/4 chance that she has Omicron. And if it was a breakthrough, it was probably Omicron, but it doesn't matter. The guidance is the same. Anybody who tests positive, 10 days of isolation after that point, meaning you got to stay home and try to limit that either from the time your symptoms start or the test is positive. So the variants, and that can be confusing. Thank you for asking that question. The variants we know at the population level, but I can tell you it's about a 75% chance that it was Omicron if it was just last week. Whereas if it was a month ago, 99% it would have been Delta. Okay. All right. So Simone Downs, Kristen Korkowski, a couple people are asking about, are we going to shut down again?
Now, I have had that question.
Yeah, I'm sure you have. What do you say when folks ask you that?
I say that we'll know when either Dr. Awadi or Dr. Ezike tells us that.
Yep.
I sort of feel like we're moving in that direction, though. But I would hope that the message of getting vaccinated is getting out to people, because I don't think people want to move back to being shut in.
Yep. And yeah, I would echo that, our goal, let me tell you, is to not shut down. We're watching really closely what's happening with Omicron, around the world. There have been countries in Europe that have had to shut down again. The Netherlands on Sunday announced that, you name it, in terms of anything that was not absolutely essential is shut until the middle of January. Restaurants, et cetera, are completely closed. They basically canceled all parties, gatherings, et cetera, even ahead of the holidays. Now, why are they making that decision? Because they're running out of space in their hospitals. And at the end of the day, the thing we are watching the most carefully, that's part of why I showed you how on the dashboard you can see what's happening with hospital capacity. We cannot run the risk of running out of the ability to provide medical care for people. That's got a lot of problems that go far beyond COVID. I worked in, some of you know, I worked on the Ebola outbreak in Liberia, and I was in Liberia during the early times there where the entire health system did shut down. And once you've seen that once, there's nowhere for people to go have babies safely. There's no, people are having heart attacks. You don't have enough room to take care of people in car accidents. So many healthcare workers are sick. People can't get their medication. I mean, the indirect effects become huge. And so the thing we are watching the most closely is our healthcare system. Every single day, our hospitals are letting us know what is their capacity like, not just how many beds, but how many beds can they staff? Because staffing is really as much the issue as sort of physical beds at this point, just with a lot of the changes that have been made. So I do not anticipate a shutdown. I do not want a shutdown. One of the reasons for the vaccination requirement is if we can just get people vaccinated, that keeps them out of the hospital by and large, right? And that protects our health system. So, Simone says the positivity rate is scary. It is scary. I agree. We'll be watching it closely. But the fact that we're seeing this kind of positivity and this kind of case increase, but many of those people not being sick enough to be hospitalized, that's because of prior protection. Mm-hmm. So, all right, a number of questions here about vaccinations and boosters and numbers, et cetera. So I just want to say, is it possible to get a breakthrough infection even after a booster? It is possible. It is not happening frequently, and we are not seeing people get seriously ill in that setting. But the team is actually working on, we're going to have sort of a booster dashboard piece here available just in the next, hopefully, few days by early January at the latest, so you can follow some of that even in a more detail. The epidemiology is a lot harder when you're talking about boosters, for example, because different people are eligible at different times. There's a lot of things behind the scenes in terms of how we track that. But what I'll tell you is if we include, there's about 600,000 or so Chicagoans with no proof of prior immunity, no vaccination, no previous COVID. On top of that, there's another 600,000, give or take, who had an old infection or an old vaccine. They're due for a booster, they haven't gotten it. 1.2 million people, can I tell you, that is a lot of people.
That's statewide.
Chicago.
That's Chicago?
That's Chicago. Yeah. So we've gotten a lot done. We've done more than 4 million vaccinations here, including boosters, but we have still about 600 and, I don't know, last I looked, 640,000 who neither have proof of, and that is highly worrisome. That's the thing that has me the most concerned. It is a high number. Mm-hmm. Now that includes children under 5 who haven't had the opportunity yet, but it includes an awful lot of people over 5 who are eligible and haven't done it yet. So yeah, that's why we're worried. Okay, so we're getting just about near the end here. Is there anything else you wanted to sort of, touch on or ask about or, let people know?
I just wanted to take the opportunity to thank my staff
yes.
Because they've done yeoman's work. I don't think our office shut down at all during the pandemic. I mean, we've had at least one person in our office. Even though we might have to service people outside, we keep a table outside and they have to stand at the table. And now with this new variant, we're more concerned. But I just want to thank my staff for just their commitment and serving people during this time.
Oh, I love that. Yeah, and I've got to jump on that and thank mine too. You know, this is the second year in a row that we've had an end of year acute COVID need, right? Last year it was a happy one. COVID vaccines, we started vaccinating December 15. We honestly were not really expecting to have COVID vaccines until about January of this year, and we got what was a lovely holiday present, but it still meant that my whole team didn't get a holiday break last year. And then this year again, Omicron just so fast here on top of it, and so a lot of my staff have also had to kind of cancel a lot of their holiday plans, and you know, we're on it. But I really, you know, city workers have been working, you know, have kept it going, honestly, like across the city, across departments, across alderman offices, and I really do thank folks for all the ways, you know, that they've stepped up, and just all the ways so many Chicagoans have stepped up. Like when I hear, you know, like these food needs, et cetera, like we really have, it's been a terrible year, but also it's been an amazing year in terms of seeing groups and people come together to help each other, to think about others, and you know, I hope a lot of that continues.
We just have to get over this hump.
We do.
This hump is a scary hump.
It is.
But we need to get over it.
Yep.
And I'm hopeful that 2022 will hold more promise for us.
Yeah.
You know, it's been a really hard 2021.
It has. It has. No, it's been hard. Nobody wants this to be over more than I do. But, you know, I feel like a broken record sometimes when we're just over and over and over again trying to give people the information that will best protect themselves, protect our healthcare system, protect Chicago. And one of the reasons, you know, I continue to do these twice a week, even though there are a lot of folks who come on, and I know it makes me in some ways a little bit of a target for people who are unhappy with decisions. I welcome, you know, that discussion, and as long as we are getting real questions in for people wanting to figure out, you know, what to do and how to make decisions, we're committed to keeping it going. So I do want to wish you a safe and as healthy as possible holiday season here. We will be on again next Thursday to take some questions in that sort of in between. For those of you who celebrate Christmas, New Year's, we'll do one of these again next Thursday. I'm not planning to be on Tuesday right now. But lots of information online, and please be careful. I wish that we were not seeing this big surge right on top of the holidays, but we are. So there's vaccine available. Now's the time. Tests, a little harder to get, but available. I'd order some now. Recognize you may need to wait in line at some points to get this now. And we'll get through this, hopefully without needing to do more significant mitigations, but we'll do them if we have to. So,
thank you.
Yeah, thank you.
Merry Christmas, happy holidays, everyone.
Yeah, happy holidays. Again, this is Alderman Dowell, Chair of the Budget and Government Operations Committee, Alderman of the 3rd Ward, and just a great partner in all things COVID messaging, COVID vaccines, outreach. And want to thank you again for your time, and thank you for putting in. If we didn't get to your questions, we keep track of them. We'll be, you know, we update our FAQ all the time online. We'll be adding to that, and we will be back on Thursday to get more of them. Thanks. Happy holidays.
Bye.